Our children are suffering from all sorts of respiratory viruses. Our pediatric hospitals are overwhelmed. Our healthcare workers are very tired.
We've heard it all pandemic long, but that was Federal Health Minister Jean-Yves Duclos 12 days ago. But wait, Andrew Chang, host of About That, the show where you're all about explaining and expanding on the news, you might say. I thought vaccine uptake in Canada was actually quite good. Well, yeah, it was. The vast majority of Canadians have at least 2 doses of vaccine, but we know that immunity fades away. And what the vast majority of us don't have is an updated booster shot within the last 6 months. Like, it's kind of like having a smoke detector with old batteries. Like, it's good that you have it, but maybe you're not as protected as you think. And what's more, the number of young children, so under 5, who've gotten even just 1 shot is really, really, really small.
The big concern with the under-vaccination of young kids in Canada in this chilly weather as we head towards the holiday season is the risk of having a child infect an older family member or a more frail family member at one of these multi-generational holiday events. And so when you vaccinate your child, don't just think of it as protection for them, although you are protecting them. You're also protecting all the others you love for the holiday season.
Now, we sent one of our producers to a vaccine center here in Toronto with a huge capacity to basically sit there and count how many people came through. Her name is Lindsay Tsuji, and she also has a little one at home herself. So this topic really matters to her. Hey, Linz, how you doing?
Hi, Andrew. This is very weird.
You've never been on camera before?
Years ago, but
Okay.
It's been a while.
Okay. Well, this will be painless, I hope. So tell me, I mean, we've seen some of the footage, right? Like, tell me what your experience was while you were at the vaccine clinic. What did you think?
Right. Well, so mind you, we went on a Tuesday, so it may have been a slower day. People were probably at work or at school. But, the city told us that generally the busiest times at the clinic were when it opened at 12 for that hour and then at 4:30, so maybe right after work. When I was there, you could definitely feel like it was a bit slow, for sure.
Because that's a big place. I mean, they could accommodate lots of people.
110 people.
Wow.
110.
Okay.
And
per hour?
Per hour.
Okay.
Yeah. And the final number that they gave us in terms of how many people came that hour at 12 was 45.
Huh.
So they were well under capacity.
Right. Yeah. Nowhere near capacity, and this is supposed to be at one of the busiest times of day.
Exactly.
For a Tuesday.
Yeah.
I guess.
Yeah, and I could definitely sense that. And I think I have a clip. Hey, so I've been at this clinic for just about an hour now, and I've seen some older folks walk in, some parents with kids, but considering just how big of a space it was, with the chairs lined up and the vaccination station set up, it seems like they could accommodate a lot more people.
Yeah, no kidding. And I've been to this particular clinic multiple times, and every single time I've gone, whether it's on a weekday or a weekend, it's looked like that. It's looked pretty empty. So I don't know, like the people who did come in, did you get a chance to talk to them or ask them questions?
Yeah, I spoke to a few people. They were hesitant to go on camera, but there were some older folks that were there for the flu shot. There were people there to get their COVID booster, but they were generally pretty tired about talking about COVID.
Sure.
You could really sense that COVID fatigue was a real thing.
Right.
But there were people that were more interested in talking about, RSV, the flu, which is going around as well.
You mentioned you bumped into sort of some older people while you were there. Did you notice much of a spread in terms of ages of people that showed up, like kids versus adults, that sort of thing?
Yeah, it was generally seniors, and then a few parents with kids. But like that in-between age, like teenagers or people in their 20s maybe, there are few and far between.
Okay, because particularly when we do talk about kids, what do we know about vaccine uptake? And I'm thinking like young kids.
So the COVID vaccine has been available to young kids since July 14th, which
it's been months now, right?
Yeah, over 4 months. And uptake has been pretty low. So only 7.3% of kids 4 and under have been given at least 1 dose.
Okay.
And 2.4 received 2. To put that into perspective, by comparison, 86.9% of Canadians 5 and older have received the 1 dose,
right,
and 84.3% have received 2. So that's a big difference. Back at the immunization clinic, it's funny, you could really sense that staff there were trying to put in the effort to make kids especially feel welcome and at ease. And I'm just going to show you what it looked like inside. So I just wrapped up at the immunization clinic, and after walking around and talking to some staff there, I was struck by just how welcoming they were trying to make it feel for kids in particular. On the pillars there were drawings that kids had made, modesty pods, just the effort that's gone in to try to make it a little more pleasant for young people.
I think some of those drawings were my kids' drawings because they colored a bit and then
That's
put
so
some
great.
up.
Yeah, and they were all over the place. And I mentioned those modesty pods there. Those were sort of closed off areas where if staff saw that kids were, visibly shaken up, or if they were scared, parents could take their kids and get the shot sort of in a quiet, safe space.
Right.
Yeah.
Now, Lindsay.
Yes, Andrew.
You know why, part of the reason why we asked you to do this particular segment, because we're talking about young children,
yes,
vaccine uptake among young kids. You have a beautiful young daughter.
I do.
Can you tell us about her?
For sure, yes. So my daughter, Noemi, is 2 years old.
Beautiful name, by the way.
Oh, thanks. She's 2, so she's a COVID baby. And
right.
It's hard to say, like my family, my partner and I, we are 100% pro-vaccination. I have 4 doses, my partner has 4 doses, but I'm gonna admit, we haven't gotten her COVID shot yet. And
do you plan to? I mean, what's the thinking?
The plan is to do it, and it's hard to say it out loud because what that might imply to friends and family, and but I think there are a few factors that have led to sort of this lack of action on my part. Anyone with a toddler, I'm sure you can understand, knows that your kids are sick all the time if they're in daycare.
Oh my God, yes. Yes,
right? So,
they're always sick.
Exactly.
Yeah.
So finding that sweet spot where they're not sick, where we're not sick, when everyone's available, that sweet spot, it has been challenging.
Right, because
sure.
My understanding has always been if you're wildly symptomatic, you're not supposed to be out and about, and you're not supposed to go get your COVID shot. So finding that window is tough.
I think secondly, the whole family got COVID last year. So in my mind, I'm wondering, is the immunity that she gained from being sick from COVID, does that still offer protection? And I think about she's young, she's 2 years old. And as a first-time parent, you don't want to mess anything up. You don't want to, any lasting effects that a shot like that might have. Those are sort of things that are swirling in my mind.
Yeah, that's something that any, even me, I mean, I have 2 kids, right? It's something that I can certainly empathize with. And like you mentioned, Noemi being 2 years old, I mean, I feel like we've also heard from doctors over and over again that COVID doesn't tend to present in a severe way, like typically, with very young kids. It is primarily older people.
And that's definitely something I've thought about, is it really worth the trouble or the risks involved to get the shot if she's going to end up not getting that sick or not even present with symptoms at all.
It's both brave of you to talk about this so openly, but it's also like these must be such common feelings, right, and thoughts among so many parents out there. I mean, even in your social circle, you must hear other parents
for sure.
with the same concerns.
I'm a part of a number of parenting Facebook groups where people throw out questions about their kids or how to tackle a parenting question. But at the height of COVID, the COVID vaccine in kids has been such a touchy subject, and it's hard to talk about out loud in public because the opinions vary. Because we're talking about our kids. We don't want to mess it up because they're the most precious things in our lives.
Of course.
Yeah.
You've given us a lot to dive into, Lindsay. Thank you so much.
Thanks, Andrew.
Now, I'm guessing that some of that rung true for you folks listening, and I mean, it absolutely did for me. Those questions are among the very same questions that I have asked myself since the vaccine first became available. So I'll tell you what we're going to do. You remember Dr. Danielle Martin from earlier in the program? I was interviewing her just outside the CBC building. In just a moment, we're going to bring her back, and we're going to play a little game with her, using some of the many questions and concerns we've heard from parents like Lindsay. We're back after this. Hey there, welcome back to About That. We are here right now in our lovely studio with family physician, Dr. Danielle Martin, who's going to help guide us through, help us to understand why this issue of vaccine uptake, particularly among young kids, why it's been so low. And, you know, we just heard a few moments ago, we were hearing from Lindsay, a number of different reasons, right? And concerns. You must hear this kind of stuff all the time.
We hear this stuff all the time in the family medicine office, and you know, we welcome it because these are all really legitimate questions and concerns that parents are raising, and it's supposed to be a dialogue. So, for example, you know, this notion of, I don't think COVID is all that serious an illness in children, which is actually true. I mean, most kids who are infected with COVID-19 will not become really seriously sick. Now, of course, there are exceptions to that. Some kids do become very seriously sick. And in this time of massive respiratory illness and infections happening with, you know, huge numbers of children in emergency departments and being admitted to hospital, mostly with viruses that can't be prevented, this is one that can actually be prevented with a vaccination. So there's that to consider. But, you know, the reality about vaccinating your child is that it's not just protection for them, it's protection for everyone they come into contact with. Yeah. Our parents, you know, the grandparents of our kids, people are dying all over the world still every day from COVID-19 infection, and not just unvaccinated people. So anything we can do to protect our loved ones in our multi-generational families and communities is a good thing. So vaccinating your kid against COVID-19 is protection for others, not just for them.
And I guess all of this would be easier to have this kind of conversation about if, like, and I'm thinking of your family practice, if the COVID vaccine, if that was kind of the first stop for getting vaccinated, right? Because that's not the case right now.
And that is, you know, that is, in my respectful view, a mistake that we have made in the vaccine rollout in Canada, is that we have not made it easy for family practices and primary care pediatric practices to give out the COVID vaccine. I mean, I give vaccines in my practice all the time.
Yeah, sure.
Every day I'm vaccinating kids against all kinds of illnesses, and their parents bring them in, ask their questions. We have dialogue. We vaccinate their child, and there's a trusting relationship there.
Is this going to change anytime soon?
I hope so. I hope it will slowly change over time. There are some like logistical barriers that are not small. Everything from a multi-dose vial, if you only see one person in your practice that day, and you have to use it all up within a specified period of time. So will we see a move towards more single dose? But other countries have done this. In the UK, the majority of vaccination for people of all ages against COVID-19 has been given in family doctors, GPs' offices. And so it can be done. And I think the more we normalize this vaccine, so you're willing to bring in your kid to get vaccinated against tetanus, diphtheria, polio, pneumonia, you name it. COVID-19 is just one of many vaccine-preventable illnesses. It needs to be incorporated into the routine way that we approach childhood immunizations. And then we can begin to address these very appropriate questions that parents bring, and that in a trusting relationship, you can usually find common ground. Sometimes it takes more than one conversation and people really listening to each other.
Dr. Martin, can we play a game?
Yeah, let's play a game.
So
let's do it.
Folks at home might be wondering why we have this mysterious looking, what is this? Like a vase?
Yeah.
Why we have this on the table. And I would be remiss if I had someone of Dr. Martin's expertise here on set and I didn't just bombard her with questions, exactly the kinds of questions and concerns that parents have when it comes to vaccinating their young children against COVID. So in this are a bunch of concerns.
Okay.
And don't look at them. but go ahead and pull what you're still looking at.
I'm going to pull one out. I'm trying to get an easy one. Okay, here we go.
And then address it.
Okay. Oh, this is a good one. The COVID-19 vaccine was rushed. I want to wait and see how the vaccine is working for other young children. So this is both true and not true. It is true that the development of this vaccine was done extremely quickly, but there is a myth out there that means it didn't go through all of the normal stages of being studied and followed and approved. And in fact, it went through all of the same stages that approval for any vaccine or drug goes through. The only difference is ordinarily we would do those things one after the other in series. In the case of the COVID-19 vaccine, a lot of these steps were done in parallel.
Yeah, all at the
they
same
were done
time.
simultaneously. Yeah. It doesn't mean that they weren't done. So we have no steps were cut out of the process. But this wait and see thing is important, and I understand the instinct for it. I think that the thing that we need to keep in mind is that while we're waiting, our child can get infected with COVID-19, and that also has potentially serious ramifications.
Right. Well, there's
so
a ripple effect, as you've been pointing out, right?
And also for the kid. And so we just need to be careful about, waiting and seeing is not delaying a choice. It is making a choice. It's making a choice not to vaccinate your child. You might make a different choice later, but right now you are actually actively making a choice, and it's got ramifications. That's all. Okay, here we go. It's like coming to my office. We've only got 15 minutes, man. Okay, here we go. I don't want to drag them for their shot every 6 months. I'd rather just learn to live with COVID. Yeah, I get that. I wish that that the immunity lasted longer. But I will remind the parents who are watching this, and I myself am a parent. I brought my baby into my family doctor's office when she was 1 week old, 1 month old, 2 months old, 4 months old, 6 months old, 9 months old, 12 months old, 15 months old, 18 months old, and she had vaccines at almost all of those appointments. And I wouldn't have missed them because I did not want my kid to get polio or, measles or any of the things that she was being vaccinated against. And many of those are boosters. Of this, we don't know. How many times do you need to get boosted at the 6-month interval before you're pretty much good? Where that is something that we are going to have to learn because we just haven't been living with COVID for that long. These are good questions. I wear my mask and the kids wear their masks. That should be enough protection. So first of all, that is great protection.
Yeah.
If you and your kids wear your masks, it is very good protection, not just, by the way, against COVID, but against RSV, against rhinovirus, against all of the other viruses that are circulating right now in our communities. Of course, it only works if you and your kids are always wearing your masks, firmly fitted around your nose and chin, not taking it off to eat and drink, and it also only works if everyone around you is also wearing a mask. But we are not in an environment right now, for better or for worse, where everyone in the indoor environment is masking consistently all the time. So we're just trying to line up layers of protection.
Right.
The mask helps. It's not perfect. The vaccine helps. It's not perfect. Washing your hands helps. It's not perfect. Staying home when you're sick helps. It's not perfect. If we all do all of these things, then we can slow the spread of not just COVID, but all of these other diseases.
I think we've got time for maybe one, maybe two more.
Okay, okay. I'll try to be quick. If I get my hand stuck,
Yeah, sorry.
what happens? What happens?
I don't know why the opening
I
of this.
think we have to
need
shake
a different
it.
jar.
Shake
right?
it out.
You got
Here
it?
Yeah, I got it. Okay, here we go.
What do we got?
COVID keeps changing. The vaccine probably isn't effective. So, I mean, that's a
tough one, eh? Because COVID is constantly changing.
all of these viruses are constantly mutating. Yeah. That is what viruses do. This is the same reason why we have to reinvent the flu shot every year.
Sure.
Because influenza, like other viruses, is also always changing. It's not the case that the vaccine isn't effective. Vaccines that we have seem to be pretty effective so far against all of the variants that are emerging.
Right.
And of course
that has remained more or less true through
That has
Alpha,
remained more
Delta,
or less true through
Omicron.
all, thank goodness, knock on wood, because otherwise we would be back at square one with not enough ventilators in the ICU, right? So thank goodness, it seems to be the case that it is pretty effective against all of the known strains right now. There is, of course, now the bivalent vaccine available in Canada, which has some specificity for the current variants that are out there in the community. Yep. So probably the vaccine will continue to evolve as the virus continues to evolve. But just the good old COVID shot, the one most of us got at the very beginning of this pandemic, is a pretty effective protection against the known variants that we have now. And you know what it's much more effective than? It's much more effective than nothing.
Nothing.
So I'll take it. I'll take it. Okay, do we have time?
I think we have like 30 seconds.
Okay, all right, I'm gonna.
Let's just do a quick one here.
Quick.
These are so good.
I can't.
And there's
I
more.
can't.
Like we could just keep going. Or did I lie?
Here we go. Okay, very quickly. Here we go. My child is terrified of needles and it's not worth the trouble. So just quickly, a couple things. Rewards work with most kids of most ages. There's also a numbing cream or patches that you can buy at the pharmacy. Talk to your pharmacist about it. That lessens the pain of a vaccine. But also, I mean, I've had a lot of screaming kids in my office who don't like needles. I get it. What I will say is, and I say this with respect, at the end of the day, we are the parents. And if there is something that is important for the health and protection and safety of our kids, we generally will firmly and calmly and lovingly not give them a choice about that. You push through. And you know, that's why they have ice cream afterwards. Just saying.
My kids would agree.
Yeah.
Hey, Dr. Martin, thank you so much.
Yeah, my pleasure. Nice to see you.
We will be back after the break with a final thought. Hey, welcome back to About That. Now, I realized that I couldn't very well go this entire episode soliciting other people for their thoughts, and their questions and concerns about vaccinating young children without explaining maybe a little bit about how I and my wife approach the issue. So we have 2 young girls. So I have 4 COVID shots, so 2 boosters. My wife has the same. My eldest daughter has 3 shots, and my youngest daughter, 5 years old, has 2 shots. But yesterday, I asked my wife, did you ever have any hesitation at all about getting our kids vaccinated? And she didn't miss a beat. She immediately answered no hesitation at all. And just for your information, I mean, she has a sciencey background, so she has her master's in chemistry, and she was saying, look, the likeliest negative outcome of the COVID vaccine would be either that they had an allergic reaction to it, or that it just didn't work. And she sort of made me laugh when she said, it's not like it's going to turn your kid into a lizard or something. But I even asked her this question, whether it would have made a difference to her if our kids were much younger than they are. So if they were 1 year old or 2 years old. And again, she answered no right away. And she said the same thing that Dr. Martin said a few moments ago, which was that our very young kids, I mean, we do get them vaccinated against all sorts of diseases from very young ages, right? Measles, tetanus, polio, meningitis, diphtheria, like diseases where I'm not even actually exactly sure what they do. But I have seen what COVID does, and that's not always pretty. Anyways, that's just how we approached it. But everyone's going to approach it differently. And thanks for watching. Thanks for listening today. It's been a pleasure. Take care.